Every visit to a doctor's clinic is more than a transaction, it's a promise. Each medicine you present represents a social contract between science and society. Patients trust that what you offer is safe and necessary. Doctors trust your information is accurate and unbiased. Your company trusts you to uphold its reputation. This chain of trust is the foundation of the pharmaceutical industry. A single broken promise can disrupt this fragile ecosystem. Patients rely on doctors, and doctors rely on the data you provide. You are the critical link in this chain, the face of science. The responsibility is immense. Failure means compromised health and lost trust. This contract is the invisible ingredient in every medicine. It's a commitment to patient welfare over profit, to truth over marketing. You are the final guardian of this promise. This is not just a job, it's a vocation with a moral purpose. Every interaction either strengthens or weakens this sacred contract. Let this higher purpose guide your every action. To honor the social contract, you must understand India's 3 key pharma regulators. The CDSCO is the national authority, approving drugs and ensuring safety. The NPPA controls prices, making medicines affordable and accessible. The Department of Pharmaceuticals, DOP, sets industry policy and enforces the UCPMP. CDSCO governs the drug, NPPA the price, and DOP your conduct. Ignoring their mandates risks your career and your company. These bodies ensure medicines are safe, affordable, and ethically promoted. Know their roles. Your professionalism depends on it. The UCPMP 2024 is now law, not just a guideline. It severs the link between sales and incentives, focusing on science and patient welfare. The code ensures doctors prescribe based on patient needs, not gifts. Your role shifts from salesperson to scientific liaison. UCPMP 2024 covers claims, events, and prohibits unethical practices. Non-compliance brings severe penalties, but compliance is an opportunity to rebuild trust. This is the new standard, embrace it. UCPMP 2024 boils down to 4 commandments. First, no inducements, no gifts, cash, or benefits to influence prescriptions. Second, scientific truth. Every claim must be accurate and evidence-based. Third, full transparency. Always disclose your affiliation and intent. Fourth, education over entertainment. Events must be about learning, not luxury. These rules eliminate conflicts of interest and protect patient trust. Your job is to be a messenger of science, not a marketer of fiction. Every interaction must be honest and professional. These commandments are your North Star. Follow them to build lasting credibility. Your responsibility continues after a prescription is written. Pharmacovigilance means monitoring and reporting adverse drug reactions. The Pharmacovigilance Program of India, PVPI, collects this data nationwide. You are a key channel for reporting safety issues. When a doctor mentions a side effect, document and report it immediately. Ignoring this duty risks patient safety and legal consequences. Your vigilance upholds the social contract and protects public health. Reporting adverse events is simple. Remember the 4-dot rule. Capture an identifiable patient, an identifiable reporter, the suspect drug, and the adverse event. You don't need full medical history, just these essentials. Protect patient privacy, use initials or age. Record the doctor's contact as the reporter. Clearly name the drug and describe the reaction. With these 4 dots, you have a valid report. Pass it to your pharmacovigilance team immediately. Act fast. Patient safety depends on it. Once you have the 4 dots, the clock starts. Report within 24 hours. Use your company's form or app. Don't rely on memory. Transmit the information immediately. Don't wait. Your company must report serious events to regulators within tight deadlines. Delays can mean legal trouble and risk to public health. Mastering this SOP is essential for every ethical pharma professional. Safety comes before sales, always. Compliance is following the rules. Ethics is doing what's right. Compliance asks, can I do this? Ethics asks, should I? Ethical leadership means prioritizing patient welfare and integrity, not just ticking boxes. Managers set the tone. Focus on the spirit, not just the letter of the law. Build a culture where reporting and transparency are valued. Teams led by ethics earn lasting respect and trust. Success built on integrity is sustainable. Pharma ethics in India has evolved from a sales-driven Wild West to a science-based, patient-centric model. Lavish gifts and incentives once dominated, eroding trust. Media and public scrutiny exposed these practices. The voluntary UCPMP was a start, but inconsistent. The new UCPMP 2024 is legally enforceable, leveling the playing field. It marks a cultural shift. Science and transparency now lead. Your role is to champion this new era, uphold integrity and restore public trust. The industry's future depends on your ethical conduct. Be the voice of change. Unethical behavior often starts with rationalizations. Everyone else is doing it is no excuse. Anchor to your code, not competitors. It's just a small thing erodes integrity. Small breaches lead to bigger ones. It's for a good cause doesn't justify unethical means. The process matters as much as the outcome. True patient benefit comes only through ethical actions. Don't let rationalizations take root in your team. Enforce all rules, big and small. Your reputation is built on consistent integrity. Compromise once and you compromise everything. Managers shape team ethics more than anyone. Ethical leaders talk about integrity openly and often. They reward ethical behavior, not just sales. They lead by example, never asking what they wouldn't do themselves. Their actions set the standard for the team. When managers cut corners, teams follow. When managers uphold the highest standards, teams are inspired. Success and integrity go hand in hand. Be the leader who proves it. Every day, you choose between shortcuts and integrity. Shortcuts may bring quick wins, but they're fragile and risky. Integrity builds lasting trust, respect, and career security. Doctors value honest, knowledgeable partners. Your company trusts ethical leaders with greater responsibility. Sleep well knowing your success is earned. You are a guardian of public health, not just a salesperson. Let integrity guide you. Patient welfare is your true north. Build a legacy of trust and value. That's the career worth having. Earth.